TED Talk, we were kind of inspired by something that Chris mentioned last week when we were talking about something Chris mentioned last week about how we kind of need to narrow our focus as far as athletic training goes. So what we're going to do is we're going to kind of have a bit of a discussion up here between each other and then kind of tie y'all in. Dana's going to talk about everything that athletic trainers can do and are currently doing, and then we're going to come back and I'm going to talk about why we shouldn't be doing some of those things. So,
So a common question nowadays is, what is an athletic trainer? So an athletic trainer is a healthcare professional that works in conjunction with physicians and other healthcare professionals and specializes in injury prevention, rehab and treatment, administrative responsibilities, and therapeutic interventions. So a lot of times athletic training gets misconstrued with personal training or other types of training, and they're two completely different types of professions. So it's important to be able to distinguish what an athletic trainer actually is. And also a lot of times athletic trainers get misconstrued into people thinking that they only work with the athletic population. They also can work in numerous types of jobs. So settings, there you go. So the different settings that an athletic trainer can work in is occupational settings. You can work in hospitals, military, performing arts, clinics. You can work in different types of sports, professional sports, high school sports, so different things like that. So an athletic trainer's job is, it can vary, but we don't only work with the athletic population. You can work with a bunch of different types of patients.
Yep. Okay, so and she brings up that point, but I also want to briefly talk about all the different things that athletic trainers have to deal with on a daily basis and whether they should or shouldn't be. So as an athletic trainer, you're going to have to be potentially at one point or another, a dietitian for a kid, a counselor, be able to help with psychological issues. And like she said, we're getting into more and more different fields. The industrial setting, you can work with like geriatrics and senior athletes, and it's. I personally think that we're like Chris mentioned that we're broadening our horizons a little bit too much, and that we really need to come back and focus. Like I know that personally, by the time I finish this program, I'm not going to be very qualified to give much advice on anybody's diet or nutritional, health. I have one base nutrition class and one sports nutrition class, and that's not enough to be able to advise somebody on their dietary needs on a daily basis. And that is something that's pretty common. I know that I have one strength and conditioning class on top of a few exercise science classes. I'm not going to be qualified based on the education that I get here to advise on, the array of sports, strength and conditioning type questions I'm going to get. And I personally may be, but that's not the case for everybody. I mean, just because that's something that you're interested in and you try to advance yourself in doesn't mean that that's what your job is. And I think that, that's kind of a big issue, that we continue to expand the amount of things we do without drastically increasing the training. Now, if you personally, you get your athletic training degree and then you decide you want to get an advanced degree in, in nutrition or psychology or something like that, then that's a little bit different because, you're getting those dual credentials and that extra training. But as far as what the base athletic training degree and certification gets you, we really need to focus on our scope of, like she said, the orthopedic kind of intervention and rehab, modalities, stuff like that. Whereas I don't think that I personally should be counseling a kid that's having some kind of psychosocial crisis, and that's a big part of the issue. I mean, I have one psychology credit that I got from high school 5 years ago, and that's going to be the basis to qualify me to counsel this kid, this athlete that's having some kind of trouble, mentally or psychosocially, and I don't personally think that that's what we need to be doing as far as advancing our scope of practice.
Yeah, so just to wrap it up, it's important to stay in the scope of practice of what an athletic trainer is and to not branch off too much on the limited education that we have on other fields such as nutrition and psychology and different things like that, and be able to refer those to the proper healthcare professionals.